My name is Cahir and I'm an osteopath here at the Bridge Centre in Mickleover, Derby. Osteopathy is a hands-on therapy, it's a manual therapy, and so osteopaths are concerned with using their hands in the treatment of areas of musculoskeletal discomfort for patients. And that can take a number of different forms across osteopathic techniques. Myself, I use a structural approach, and so I use a lot of joint articulation, a lot of soft tissue work, and perhaps manipulation as well. The techniques use two methods of reducing pain, but what osteopathy is really good at is getting people back to function, back into life, so that they can do things that they love, and the techniques that you employ depending on the age and the presentation. Myself, I see adults, and that's really from 18 up to, I think the oldest patient I've had is 96. The variety of complaints across that is very different, from elite sports people, all the way down to the weekend warrior, down to the office worker as well, who does too much work hunched over a computer. About 6 treatments is a course, and after that people can opt in depending on what their lifestyle demands are, what their performance requirements are in sport, for example, for a little bit of top-up treatment. And that can be for some people every month, for some every season, so maybe 4 times a year. So that varies. Again, it's not a one answer fits everything, it depends on the person. And some people just come in for that initial course of treatment and they don't feel they require the maintenance. Yeah, I think the depth of training that osteopathy offers you as a practitioner allows you to be confident in your diagnosis, because we're one of the rare professions within the complementary healthcare field that are able to make a diagnosis and refer on to another practitioner. Osteopaths are excellent at getting people back into activity, and they do it in a way that inspires confidence in their patients to return to full participation in those things that they like. And at the same time they recognise their limits, they're able to contact other people if they need to be. So for example, maybe asking for further imaging or sending off for further tests. I think osteopathy doesn't work in isolation. And we've developed good relationships with local GPs here as a result of that.